medical malpractice and death cases in Joseon, Korea. In 1658, King Hyojong developed a boil on his buttock. At that time, a physician named Shin Gagwi was summoned to treat him, and the boil was healed as Shin administered acupuncture. In late April 1659, another boil began to appear on Hyojong's face, and when herbal medicine proved ineffective, acupuncture was considered for treatment. On May 4th, Shin, who was at home due to his own chronic illness, braved his condition to go to the palace. He diagnosed that the poison from the boil was spreading to the face, forming boils, and that acupuncture to release the bad blood would be necessary to achieve any effect. However, another physician, Yu Husheng, who was present, opposed the idea, arguing that the boil was near the head and that it was too risky to administer acupuncture. Despite this, Shin Gagwi followed the king's orders and performed acupuncture, resulting in pus and dark red blood flowing out of the puncture site. Although the condition seemed to improve slightly at first, the bleeding did not stop, leading to excessive blood loss, and eventually, King Hyojong died from the hemorrhage. Shin Gagwi was put on trial and sentenced to death by hanging on June 10th for administering acupuncture despite having tremors. This is one of the few instances in Joseon dynasty history where a royal physician was formally punished following the death of a king. Typically, royal physicians would resign, citing their inability to serve after the king's death, or take a temporary exile, and then return to their positions shortly afterward. Harshly punishing royal physicians for the king's death would have deterred skilled practitioners from serving in the court. According to Professor Kim Han-soo's research, which is based on primary sources like the Annals of the Joseon Dynasty and the Diaries of the Royal Secretariat, as well as other secondary sources, the causes of King Hyojong's death from a modern medical perspective are as follows. The Diaries of the Royal Secretariat describe the symptoms as small boils. However, the Chinese character for boil can also refer to a pyogenic inflammation on the skin, an abscess caused by unclean skin, or a swollen area caused by bacteria entering hair follicles or sebaceous glands. The research suggests that King Hyojong's condition could have been a relatively large pyogenic lesion caused by bacterial infection, rather than a simple skin boil. There were indications that King Hyojong's health was not good at the time. Records show that he suffered from various illnesses since his ascension to the throne, and was bedridden for about 10 months due to an unknown disease around the age of 35. In his later years, particularly during the 9th and 10th years of his reign, he frequently received acupuncture and took medicine, with physicians taking turns to be on duty. Professor Kim noted in his paper, "Given the previous records of illness, it is plausible that King Hyojong had other systemic diseases that could exacerbate inflammatory conditions, and it is likely that he suffered from diabetes and related complications, a hereditary condition among the royal family, including King Sejong and King Sejo." The location of the boil was also problematic. Professor Kim determined that King Hyojong's boil was located in front of his right ear. This area is where the terminal branches of the external carotid artery, including the superficial temporal artery, which supplies blood to the parotid gland, cheek, and temple, are situated. Kim's review of historical records indicates that Shin Gagwi's acupuncture procedure was closer to a facial incision and drainage procedure rather than a simple acupuncture technique. The type of needle used for boil treatment is a knife-shaped needle, similar to a modern scalpel. Improper incision could have resulted in excessive bleeding due to arterial damage. Kim concluded, the preceding cause of King Hyojong's death was diabetes, the intermediate cause was an infected ear boil and facial cellulitis, and the direct cause was excessive bleeding due to traumatic vascular injury. Another case of death with acupuncture. This story is from Things Korean, written in 1908 by Horace Newton Allen, who was both a physician and missionary. He served as the first doctor at Daejeongwon, Korea's first state-run Western medical hospital established in 1885, and was also the royal physician to Emperor Gojong. I once witnessed a very tragic incident caused by acupuncture. A Korean acquaintance of mine had a 21-year-old son who was his family's only heir for 7 generations. He was handsome and relatively healthy. One day, he complained of pain in the back of his head. His father's friend offered to perform acupuncture on him. The young man's mother also urged her son to receive the treatment. In this country, where native doctors were not highly regarded, it seemed that anyone with some education thought they could practice medicine. Eventually, the father's friend boldly inserted a needle into the back of the patient's neck. However, the needle accidentally pierced the spinal cord. The 7th-generation heir collapsed and died, foaming at the mouth. A few hours later, his mother also collapsed and died from the shock. Thus, my poor friend lost both his son and wife. He was one of the few Korean men who had only one wife. This passage describes a tragic medical accident in early 20th century Korea, highlighting issues with unregulated medical practices during that period. It's particularly poignant as it involves the death of a 7th-generation heir, which would have been especially devastating in Korean culture where maintaining the family line was crucial. The accident is thought to have occurred when the acupuncture needle inserted at the fengfu point passed through the foramen magnum and damaged the brainstem. The depth and direction of needle insertion are crucial in this context. The standard insertion angle should be parallel to the skin, which would make it impossible to penetrate the foramen magnum. In Acupuncture Grand Compendium, written by Yang Jizhou, the recommended insertion depth for the fengfu point is specified as 3 pun, approximately 9 millimeters. Therefore, it is suspected that in this fatal case, the needle was inserted far beyond this recommended depth. According to a 2015 study, the mean depth from skin to dura at the fengfu point in the Korean population was 49.71 millimeters for males and 39.84 millimeters for females, with minimum depths of 36.29 millimeters and 30.02 millimeters respectively. These modern measurements demonstrate that the traditional safety guideline of 3 pun specified in classical texts was quite conservative, indicating that traditional acupuncture guidelines were established with considerable safety margins. In this context, needle insertion depths of less than 1 inch are safe regardless of insertion angle. Regarding needle insertion angles, the Atlas of Acupuncture and a Manual of Acupuncture recommend downward insertion, while the traditional Chinese medical textbook, Chinese Acupuncture and Moxibustion, recommends perpendicular insertion. Based on classical texts and traditional acupuncturists' methods, perpendicular insertion appears to be the correct approach. Even if the entry point through the skin remains the same, changing the insertion angle will completely alter where the needle tip reaches. This raises a debate about whether the acupoint exists on the skin surface or at a specific depth below it. If the acupoint exists at a deeper level, the needle should not be inserted at a downward angle. Atlas of Acupuncture recommendation: 0.5 to 1 kun slightly obliquely in an inferior direction. Bend the patient's head slightly forward when needling. Caution: dangerous point with deep needling. No stimulation. Strictly no needling in a superior direction. Danger of puncturing the cerebellomedullary cistern. In particular, as described above, when the head is lowered during needle insertion, the space between the occipital bone and spinal cord widens, making it easier for the needle to reach the brainstem. This is absolutely not an acupoint where the head should be lowered during insertion, nor is it one where the needle should be inserted downward. It is an acupoint that requires perpendicular insertion with the head raised, while paying careful attention to the depth.